Okay, over to you, Sister Ely. Thank you.
Thank you, Dr. Alipate. Good afternoon, everyone. First of all, I would like to thank everybody for connecting this afternoon, and thank you so much, Dr. Pate, for getting us connected on this host so that we can get a brief on IPC on infection prevention control for COVID. I'm Sister Ili. I like what Dr. Alipate said. I worked at CWMH Hospital, looking after clinical governance, and work closely with Dr. Pate and also with the infection prevention control team. Basically, this afternoon, our discussions is the contents is simply on a brief overview of COVID, understanding the mode of transmission in the context of IPC, transmission-based precautions, IPC measures, PPE guidance, and also decontamination. Just basically to take you through the understanding of COVID-19 for healthcare workers. I know that most of us have revisited the background of coronavirus, and we have done so much reading, and there's so much information on the net that has talked to us, and there's so many mediums that have shared about communication, risk communications of COVID-19, and I believe that it's just probably 2 or 3 slides this afternoon that's just going to talk about the background of COVID-19 and the emergence of COVID-19 transmission and IPC for COVID-19 in that context. As we all know, that coronavirus is a very large family that can cause illness in animals or humans, and several known coronaviruses has actually happened and causes respiratory infections, ranging from common cold to more severe diseases, such as acute respiratory syndrome that happened way back in the 90s, and Middle East respiratory syndrome, as well as MERS, known as MERS, that actually had happened way back as well, and coronavirus disease that happened 2 years ago in Wuhan, China, as it continues till today. The emergence as identified in so many researches of COVID, it has identified in Wuhan, China, in way back in December 2019. COVID-19 is caused by a virus called SARS-CoV-2. Early in the outbreak, many patients were reported to have a link to a large seafood and live animal market, but later they found out in so many researchers that says that no link to the market indicating person-to-person spread of the disease. Later, travel-related exportation of cases were actually reported. Basically, I would like to take us to the understanding of COVID-19. COVID-19 is a coronavirus disease. It is caused by a coronavirus named as SARS-CoV-2. The symptoms are fever, other respiratory presenting symptoms, and as the Ministry of Health have actually put up several advisory measures to actually informed us about the symptoms of COVID-19 in terms of its presentation. And then, as you all know, if you have been contacted by our laboratory and you are confirmed positive, you should, if you're at home, you should immediately call 158 or isolate at home. Our hospital outbreak team, a response team, if you're a healthcare worker, or our SOT team will actually see to your evacuation. And the number of Ministry of Health is available to everyone who is out there sick, who needs to seek immediate advice, hospital advice. And if you're sick and you know that or families that has presented with severe disease, they can contact 165 is the contact number. So basically, I just want us to talk about COVID in the context whereby we look at it as we know that this is a new disease, and its emergence in the world has actually brought about remarkable, devastating changes and crises, and it's important as healthcare workers that we understand the basics and the emergence of COVID. If we basically talk about the transmission of COVID, the primary transmission of COVID-19 is from person to person through respiratory droplets. No other ways. There are so many people that has discussed about so many ways that that COVID can be transmitted. But basically, according to WHO and even CDC, the primary transmission of COVID-19 is from simply person through respiratory droplets, and droplets are released when someone talks, sneezes, or coughs. Infectious droplet can land on the mouth or noses of people who are actually nearby and inhale it into their lungs. COVID-19 may also be spread if you touch contaminated objects and surfaces. Recent data has suggested that transmission by people that are even not showing signs and symptoms or asymptomatic are susceptible to actually transmit the virus. As with many respiratory pathogens, a short-range inhalation of aerosols is a possibility for COVID-19 transmission, particularly in a crowded medical wards and in inadequate ventilated spaces. And certain procedures in the health facilities can generate aerosols and should be avoided whenever possible. This is very important for us healthcare workers to understand in the context of COVID. In terms of its transmission, it needs to be, we need to understand how these pathogens can actually survive on the surface, and particularly in a very crowded place, since we do not have the sophistication of single rooms dedicated for cases, for COVID cases. We are actually cohorting many of our cases, and we have really need to understand the importance of these respiratory pathogens and how the short-range inhalation aerosols can be a possibility mode for COVID transmission. If we look at this slide on mode of transmission of COVID, it's just a very simple slide. If someone sneezes, an infected person sneezes, and infected droplets is actually suspended in the air, and infected droplets get onto your hands. You actually walk into that place, walk into that office, or you probably walk into the pantry, or you walk into a place of work, and you touch the droplets, get on your hands, and straight away touch any surface or probably a person, and you sneeze, cough by the infected person, and the infected droplets can actually suspended in the air, and you have a possibility of actually transmitting the virus. We can see that people that are high risk were for severe COVID, or for high risk for severe illness in some cases. People who get COVID-19 can become ill and also develop difficulty in breathing, as we've actually seen that most of our cases that are presented now in the hospital, they are actually presented with severe COVID. Even for those who actually presented down at the FEMAT field hospital and the ones that have presented to ED, we can see that most of our cases that are coming in now are presenting in with severe COVID. And this is something that Fiji or the Ministry of Health is trying to avoid and educate and give releases into many publications to the public to actually advise that we avoid severe illnesses. So any signs and symptoms of COVID, they should be presented early into the hospital. And the risk of severe disease increases steadily as people age. and those of all ages with underlying medical conditions. These are the criteria of people that they may develop more COVID complications because of their comorbidities. And as more data become available, additional risk factors of severe COVID will be available. What is the role of IPC in terms of COVID? Why do you think it's very important that we share with you the rules of IPC in terms of COVID? Our main goal is to support the maintenance of essential healthcare services by containing and preventing COVID-19 transmission within the healthcare facilities, to keep patients and healthcare workers healthy and safe. The advice, support of all healthcare to all healthcare workers is quite very important at this stage, and how best we can institute corrective measures in terms of COVID. I'm just going to talk about, these are the IPC priorities for any healthcare settings, standards set up by WHO, that it is very important in terms of the rapid identification of suspected cases. We have that set up in the hospital, the screening, the triages, limiting entry of healthcare workers and visitors. We encourage people to work from home, immediate isolation and referrals for testing, grouping of patients and testings, immediate identifications of inpatients and healthcare workers, adherence to IPC practices, and appropriate personal protective equipment. Those are the major IPC priorities that we are focusing on. Basically, we look at what are the basic IPC practices that needs to be shared across the whole hospital. All healthcare workers need to adhere, and every healthcare worker need to understand the SOP or whatever protocols and policies of IPC guides are available in terms of COVID, and that becomes the priority of IPC in this pandemic. When we look at the transmission-based precautions, it's very important that we understand why are we talking about standard precautions and transmission-based precautions. When we talk about standard precautions, it's a set of practices that apply to care for all patients in the healthcare settings, and transmission-based precautions when we have additional precautions that are added to the standard precautions. It's a set of practices that's specific for patients with known or suspected infectious agents that require additional measures to prevent transmission. Standard precautions are widely used across every healthcare settings, one of which is very important, has become the cornerstone and the institute of backbone of any healthcare services, irrespective of which settings. Hand hygiene. Hand hygiene is very important. It has to be the main engineering control at every entrances and every settings that it should be there. Whether it's an alcohol-based hand rub or a sink that is available for a healthcare worker or a patient to actually access, so that they can visibly wash their hands, whether with soap and water or use alcohol. Personal protective equipment, PPE, it's very important. Respiratory hygiene and cough etiquette. It's also important that we understand the simplicity of these standard precautions, and then it needs to be adhered. Cleaning and disinfectants of devices and environmental surfaces. This has also contributed to effective eradication of COVID virus, and it is important that cleaning and disinfections is well instituted in every healthcare facilities or every levels of our care. Safe injection practices, medicine storage and handling also become part of it. When we are talking about transmission-based precautions, it's important that a healthcare worker or a person or a carer that walks into a containment zone or walk into a bedside needs to wear a PPE for contact and droplet precautions. Remember when we discussed initially from the mode of transmission, contact and droplet is very important, that you understand that this has become the mode of transmission for COVID, and additional is actually airborne. Unless an aerosol generating procedure is performed, in which case airborne precautions are needed. This is where a staff or a healthcare worker need to put on additional precautions, whereby usually they put on an N95 mask before they walk into an aerosolized, before they perform an aerosolized generating procedures, for that matter. Use disposable or dedicated patient care equipment, example stethoscope, blood pressure cuffs, and so on. If equipment needs to be shared among patients, it needs to be disinfected in between for each patient. Most of the nurses and the health staff in the hospital, they know the importance, and we need to know before we actually share equipment, because most of the time we do not have the luxury of dedicated equipment. So if still we share the equipment, it is very important that we disinfect with alcohol before it is used on another patient. While we're still on transmission-based precautions, patients are actually, they use or adequately, the room is, it should be seen to be adequately ventilated. Preferably if they're in a single room, we just need to make sure that there's good airflow. The bathrooms, it should be clean and disinfected twice daily. And we should avoid transporting COVID-19 patients out of the room unless medically necessary. So like for CWM, for that matter, because we have about more than 10 step-down medical facilities, it's very important that the communication flow should be there before the patient is probably transferred out to Paru isolation for an investigation. It is very important that we advise people on the ground, like the security, everybody else, for the many wards that we have to transport the patient across. We really need to make sure that the areas are cordoned off, securities are told to be on the ground, and actually advise that there's no movement until the patient is actually safely transferred into the ICU Paru, whereby they can get the investigation done and they get back to ANZ or Women's Medical or one of those wards. And then on the same note, it's important that we just place a mask on the patient, whether the patient is, especially for positive cases, and then they need to be advised that they cannot touch anybody else or touch unnecessary surfaces while the transfer is taking place. It's very important, and healthcare workers should wear appropriate PPE during transportation. And we do not have the luxury of transport all the time, so it's very important that healthcare workers should wear appropriate PPE during transportation. Designation is very important in terms of COVID. Therefore, only for people that are rostered and working, dedicated fully for COVID, they should be allowed to actually go in and out of the isolation rooms. And for CWM, we still restrict visitors. We do not allow visitors for some time now. If you look at the hospital triage setup, the reason why it is set up as it is basically due to the risk of transmission. So like if you look at ED setup at the moment, it's very important that we have the two different pathways. For those who presented with COVID-19, probably goes to tent, and the non-COVID goes to the other triage area. And the 1 meter distancing is very important between all patients. Please give them a mask and allow them to sit, with within that distance while waiting to be seen. And this is very important, that we support our patients even when they're coming in with COVID-like symptoms. They need to be advised. They need to be given appropriate. Their questions need to be answered, and they need to be advised appropriately. For no COVID symptoms, they are seen on the hospital triage pathway, and the appropriate people or staffs that are there to actually see them. On our isolation of COVID cases, we have various isolation facilities across CWM hospital and also outside of CWM hospital, but the care, implementation of isolation care and the principles of isolation remains the same. And the principle of moving from a containment area to a non-containment area is very important, and the separation of cases is very important, and how we move into a red zone is very important, that we institute measures in place as NAMs and team leaders are actually working very hard every day to actually make sure that the movement of patients, movement of equipments, movement of meals, movement of staff are properly monitored, so that we can lower or slow the risk of transmission. It's very important. And in terms of isolation of COVID, it's the patient's placement is very important. And while they're in the room, we just need to make sure that the rooms are well ventilated. There's clear airflow. The patient needs to ensure that they need to maintain 1 meter separation from each other. Most of these patients, they are well. 80% of them are walking around. 80% of them talking to each other. So it's important that we give them a mask, advise them to cover their mouth when they cough. These are the very important basic measures that we see that it has to be, the patients need to be told every time. And despite, even if they are in a single room, the door has to be closed all the time. Say, for example, in a place like pain ward, rooms needs to be closed all the time. Only essential healthcare workers designated to care for suspected COVID should wear appropriate PPE while approaching patients or work patients. So many ask about the fans in the isolation wards. As we know that most of our setups are not set up of isolation. So the using of fans in isolation wards, there are some key factors. We just need to see that the directions of fans should deflect away from the healthcare workers. That is, the airflow should go from healthcare worker to patient. So whenever you are planning to open the windows or open in whatever settings that you may be, it's very important, or even if you want to on the fan, and the use of the fans in this picture would work. COVID-19, as we talk about the everyday preventive measures in terms of IPC, first of all, avoid touching your eyes and nose and mouth. Avoid close contact with people who are sick. Remember that even people without symptoms can still spread the virus. Stay at home when you are sick. Cover your cough or sneeze with tissue, then dispose it off. Use a face covering when physical distancing is difficult or we're not close spaces. Clean and disinfect frequently touched objects and surfaces. Perform hand hygiene with soap and water, or use alcohol-based hand rub. Hand hygiene is very important. You have to understand the 5 moments of hand hygiene. If you do not know, please read up the 5 moments. It is very important, and you have to know this by heart. Do wash your hands often with soap and water for 40 seconds, and especially after you have been in a public place or coughing, sneezing. Use a hand sanitizer if it's available. Do not touch your eyes, nose, mouth with unwashed hands. Remember, every 10-15 minutes, you need to do that. You need to put on an alcohol-based and rub. if you are inside the clinical area, because there's a tendency that you can touch your uniforms, touch yourself, touch your face, or even touch your hair. But you do not do that, and that needs to be stopped. And this is something that I continually tell so many colleagues whenever we meet. I said, do not touch your face, do not touch your hair, do not touch your nose, because of the aspects of COVID. Respiratory hygiene is very important. It's also part of a standard precautions for COVID. Is a combination of measures taken to stop the spread of the COVID virus, especially through the respiratory behaviors like coughing or sneezing. This is very basics, and I have actually reiterated how many times tissue or cover while coughing, and then we just need to make sure that bins are instituted within every areas, every locations of the settings, of healthcare, of isolation units, or even the office, or even the place where doctors come and sit down and write. There should be a bin, and we should also have wheelie bins inside your isolation units or your red zones, because it is important to actually have them available. Otherwise, there's a tendency of people, they can just throw, they use tissue immediately, unnecessarily, and then it can expose. Do wash your hands immediately after you have covered your sneeze or cough. Basically, if we look at PPE as part of the transmission-based precautions, PPE is one of the guidance that has made a lot of remarkable difference in the life of healthcare workers if the process of donning and doffing is done accordingly to standard and instructions as given to healthcare workers in terms of the guide. Healthcare workers should use a medical mask, or at least a surgical mask, or N95 respirator while performing aerosolized generating procedures. Wear a protection or goggles or face shield. Wear a clean, non-sterile or long sleeve gown. This is very important in terms of caring for COVID. Healthcare workers should be trained on correct use of PPE. So this is why it's very important, as we discuss about isolation precautions in terms of nursing COVID cases, it's very important to have a buddy, so that buddy will be able to give you guidance in terms of the donning of PPE and also in the removal of PPE. The risk of self-contamination is quite high when removing. That's why the buddy system is very important for COVID. Looking at the personal protective equipment in terms of guidance, donning and doffing is very important to be understood by each and every healthcare worker. There's a safe healthcare worker safety guide that has been, it has remarkable a presentation in terms of guiding the healthcare worker before walking into the red zone or before walking into an area of isolation. Just a few tips to actually give you a reminder on what needs to be, what you need to put on and what needs to guide you inside the isolation area. The staff requirements is very simple for any guidance in terms of entrance into the isolation room. It is very important before entry that you perform hand hygiene, you put on the disposable gown. This is happening at the yellow zone or the green zone or whatever zone you call it. And it is very important before you walk into that zone, you should risk assess the activity that you're going to do. Assess the activity properly. What type of activity that you're going to do. And it is also important that you look at the PPE that you have that is available. Like say, for example, the gowns, it comes in a set, it comes in sizes. It's very important that you fit into the PPE that fits you very well. The gloves, it needs to be the right size of gloves, and the other PPE requirements that is there for you to put on, that is there on the guidance on staff requirements. And it is very important while you prior to your entrance into the patient's room or the patient zone, it's very important that you have a buddy, that this person guides you in your donning, walk in with your gown properly, do your work activities, whatever that you need to do, and then you come out. And when you come out, you should also remove your gloves, remove your disposable gowns, and remove your eye protection. And you perform hand hygiene in between the sequence. It's very important because in the process you might have expose your hands. You might have touched your used glove in the process, but you need to institute a good hand hygiene every time in the sequence of your removal of PPE. It's very important. It's very important. For areas like ICU or even in the medical wards, we have some step-down medical wards that are actually having cases that are intubated. It's very important for healthcare workers, if you are walking in, to actually probably review a patient or perform suctioning or perform any aerosolized procedures that's added on the list. It's very important that you find that a fitted respirator that actually fits you very well, preferably an N95 mask or a dust mask that actually protects you very well, and then that the mask needs to fit you very well. And you need to put on gloves, gown, eye protection, face shield before you walk into the area whereby you need to perform aerosolized generating procedures. And do not forget, perform hand hygiene after. I will touch the basics of environmental cleaning. As we know that routine environmental cleaning has become the basic institute of eradicating the COVID virus in the context of COVID. The routine environmental cleaning is essential, is very important, as research said that organic matter can inactivate many disinfectants. Cleaning reduces the soil load and allowing the disinfectant to work. Removal of germs such as virus that causes COVID-19 requires thorough cleaning followed by disinfection. This is why it is very important that before the healthcare worker proceeds, or before the nurse proceeds with her work in a day, she should put on the PPE, walk into the red zone, and clean or dust her areas of work. And this needs to be done in a very systematic manner because it reduces the soil load and allows the disinfectant to work. So once you do that, cleaning is well embedded, and you feel good when the patients actually clean, and also the environment is clean. And the removal of germs such as this virus, it requires a thorough cleaning followed by disinfection. So it's not only cleaning, it has to be followed by disinfection, in which, in the context of COVID, is very, very important that each and every staff that works in an isolation unit or works in the healthcare settings looking after COVID, it's very important that you know, when do you get your disinfection, how do you get your disinfection, and who has to do the cleaning, how often do you need to do the cleaning, and all checklists needs to be instituted, well in place, and it has to be followed by each and every healthcare worker who is allocated to do your cleaning. And this needs to be seen and supervised that it is done properly. Researchers have actually said that the length of time that SARS-CoV-2 survives on inanimate surfaces will vary depend on the factors such as the amount of contamination. As respiratory droplets present an environmental temperature, humidity, and others, all these, it contributes to the survival of the virus. Coronaviruses are unlikely to survive for long once droplets produced by cough, sneezing, and dry out, but it needs a thorough cleaning that needs to be well embedded in all healthcare facilities. This cleaning guide is available at almost all patient areas in the hospital. Basically, it's sort of like an additional guidance. So it focuses on the patient area, frequency, how often it should be, how often cleaning should be done. Cleaning, it should be, it should, for every isolation wards, cleaning has become the most important backbone of work for a staff that works in an isolation. If you want to get rid of contamination daily, if you do not want a cross-contamination among healthcare workers from patients to staff, staff to patients, cleaning has to be well embedded within. And supervisors, team leaders, NUMs need to supervise this aspect of environmental cleaning, because we can be doing very well with clinical management, but we do not see how the cleaner is actually cleaning the yellow zone or the red zone by the staff. How often is this done? All this needs to be well instituted in an isolation area, because it all contributes to the transmission. It's very important that we see the frequency, how often it should be done. Ideally, on almost every areas, at least twice daily. It should be done twice daily. Cleaning, it should focus on the high touch surfaces, especially shared common surfaces like the desks, because everybody comes in and sit at the forefront desk and write. This needs to be, it needs to be clean daily, and it needs to be done thoroughly. Inpatient rooms upon discharge transfer, that needs to be done as well, thoroughly cleaned and disinfected. Outpatient or ambulatory care rooms, probably at SOPD or the ambulatory bay and ED. After each patient visit, this place needs to be cleaned. It needs to be cleaned and disinfected properly. Hallways and corridors, at least twice daily. We will also need to see that is done twice daily, because high touch surfaces, including equipments in the hallways, then the floors, these are areas that sometimes the focus are actually not there, but really needs to be supervised. Our cleaners or people doing this work, they really need to be supervised. Patients' bathroom and toilets, these are actually high touch surfaces, switches, counters, sink bowls, and toilets. We will really need to see that there shouldn't be sharing between staff and patients. It shouldn't. And private patient room, at least it should be cleaned twice daily. Shared toilets, at least it should be cleaned 3 times a day. The risk when cleaning is not the same as the risk when face-to-face with a sick person who may be coughing or sneezing. Cleaning staff should be informed to avoid touching their face, their mouth, their nose, when, because this can actually, they can cross-contaminate themselves. And cleaning staff should wear impermeable disposable gloves and gowns. I can see that almost in all areas of isolations, they have dedicated cleaners. And I can say that all team leaders see that their health hygiene or their cleaning staff is actually provided with PPE, which is really great, which is good. And cleaners should use alcohol-based hand rub before putting on and removing gloves. They just need to be guided. And alcohol-based hand rub should also be available all the time in the access of cleaning or while they're doing the cleaning. In the patient care areas, clean and disinfect frequently touched surfaces, while sitting around every morning awaiting the doctor's rounds to or the doctor's review to take place. It's very important that we clean, we disinfect frequently touched surfaces with detergent, disinfectant wipe solutions. All these are available at pharmacy. Just need to be ordered and need to be seen that it is available and it is used widely for disinfecting our patient care areas. Between each episode of patient care, according to normal IPC practices or guides, after each and every care, or probably when the patient comes out of a ward, that needs cleaning needs to be done. Gross contamination of an area following a patient may require terminal cleaning. Terminal cleaning is a complete enhanced cleaning procedure that involves decontamination of an area. You can see that mostly for COVID isolation wards, we are actually doing terminal cleaning, especially when a patient is discharged or a patient is transferred down to the hotel, or in an area where they are suspected and they have confirmed positive, and then we have moved them into the red zone. So terminal cleaning is done in the green zone, whereby proper methods of cleaning is done, and it is supervised by IPC and also by the supervisors on the ground, and that needs to be done. And also this is what we've actually been doing is in CWM is actually triple cleaning. So this needs to be done in an event whereby a patient is being transferred to another ward or discharged or or deceased. Right? And disinfection for the environment is very important. And this is done whereby also when a staff or a healthcare worker has become positive, and then there's a possible contact transmission within that particular environment. So we also do a cleaning. We also do a thorough cleaning, and then there'll be a disinfection that has to take place, and then the place needs to be left for about approximately 2 hours before it is open again. The triple cleaning method that we are actually using at CWM, if we read up the WHO guideline and even SPC, they talk about the two-in-one-step clean. This is exactly what we are doing, which is a triple cleaning method. So we do a thorough cleaning with liquid detergent or pink detergent, and then disinfected with sodium hypochlorite, and then with warm water. So when that is done, it is done in every areas where ICU does do this every time, and also the respective wards are actually doing it now in terms of the eradication of COVID in cleaning. So we just need to make sure that everything is prepared well prior to cleaning. We remove medical equipments, and we have to make sure as well that our people or the staff that are doing cleaning, they wear appropriate PPE. Please provide them with appropriate PPEs, and also things that we really need to see in that isolation room that needs to be changed. It needs to be changed. Damp dust of all surfaces is very important, and this needs to be done daily. Furniture and fittings, windows, seals and frames, all this needs to be wiped down, and it needs to be done properly by the cleaning team. In completion of their work, they should remove their PPE and perform hand hygiene. We've seen in so many occasions as well that most of our cleaning, or most of our cleaners, they have cross-contaminate themselves. They have become exposed. So that means it can be in the removal of their PPEs or during the process of cleaning, they must have been sneezing, touching themselves, touch their face in the process, and they must have, there must be a contact transmission. Cleaning equipment is very important as well. So for every team leaders, for every NAM, it is important that you see that you have a appropriate place to actually store your cleaning equipment. It's part of IPC, and this is very important. And this room needs to be clean, whether it's in the sluice or whether it's probably a room beside it, but it needs to be it needs to be a clean utility area whereby storage of your equipment is safely storage, because sometimes it can be placed in a place whereby it's exposed to contaminated objects or contaminated surfaces, and then they are just left in there and they can predispose infections. And this is something that we also need to see that it is also part of cleaning. The bleach need to be freshly prepared. We have a pharmacy that prepares the bleach every day or disinfectants every day, and then this is ordered through pharmacy, and pharmacy provide us with the sodium hypochlorite or whatever disinfectants that they have, and this is provided to all isolation facilities. Please use the instructions as written by our pharmacist or the manufacturer, and then see that we read the instructions properly before we do it, before we clean. And also we have a cleaning guideline that was prepared last year, and we also have environmental cleaning SOP by WHO. If you're not happy with the guide that was prepared last year, it's also there. And soon after this presentation, you can just email Dr. Alipati if you want a copy of the SOPs that are available. It's important that bleach and whatever solution that we are using, it should be as IPC guided, and it should be proven effective, and this should be a disinfectant that is widely used, and it's widely available, and it's also available by our pharmacy, because they are the ones that will be mixing the disinfectant and giving it to us for use. So the instructions is very important, and please do not go ahead and use any disinfectants that you're provided with, because we use the disinfectants that are readily available and what is provided by pharmacy. Supervision, as I have shared in the previous slides as well, it is very important as team leaders, NAMs, in charges of isolation wards or triage areas. A good practice is good supervision of cleaning, and cleaning has to be part of the process as soon as we start work in the morning, and that needs to be well guided through to our staff every day. Cleaning should progress from the least soiled to the most soiled, to the most dirtiest area, and this needs to be done properly, and this needs to be done systematically. If you don't proceed on with an effective or a systematic way of cleaning, you will have cross-contamination. And your cleaning is not effective, and people will get exposed, and your patients will definitely get exposed. So that's why cleaning and decontamination is very important. It has become a backbone of eradicating COVID virus. Clean the general surfaces and fittings when visible, and for spillage, like what we've heard from the previous presentation that was shared by SPC, that each and every unit should have your spill kit. So should you come across any spillage in any for that incident, for that matter, you always have your spill kit available. This should be done in a systematic manner, and like I said, so that you do not miss any area. Use fresh cloths. You can come through laundry, or you can get some fresh, clean cloth, so that you can use it for cleaning every day. Or if you have Wetex, like what we have, what we have at CWM, we have Wetex that are available in stores, and this is used for cleaning, and staffs are encouraged to use Wetex, so that routine cleaning is done appropriately and done systematically. And this, if you're using cloths and other cloths or old rags, this should be stored in a closed container so that we keep it clean. After it's disinfected properly, it should be dried out, and it should be kept in a closed container. We just need to see that our cleaners or whoever is responsible for your cleaning, all these little things should be in a checklist, and it should be checked, supervised, stored properly. And then discard cloths that are no longer saturated with solution for areas considered to be at high risk of COVID-19 virus contamination. Use a new cloth to clean each patient's bed. And then soiled linen should be reprocessed properly after each decontamination process. And this should be done in a day, in a ward, at least twice daily. At least twice daily. Or if you have the number of staff, then you can do it 3 times a day. Equipments, detergents or disinfectant solutions become contaminated during cleaning and progressively less effective if they I have discussed this in the previous slide. It's very important that disinfectant solutions are actually mixed by appropriate pharmacy people, and then we give orders to pharmacy, and then we get it, because we have it in 0.5%, and we also have sodium hypochlorite with 1%. So for disinfection solution, we usually use 1%, and if you have to soak or reuse equipments, you can use the 0.5%. So all disinfectant solutions must be discarded after each use in areas with confirmed patients with COVID-19.
Thank you, Sister Ely. Does anybody have any questions that they want to ask Sister Ely? Please just raise your hand, and I will, and unmute yourself and then speak. Thanks. Sister, sorry, one question. Do you have any update on the coveralls? Can you just explain coveralls in terms of PPE, please?
Sorry. All right, thank you, Bunwai. On the coveralls, as we know that coverall is basically not recommended to be used in all clinical areas. There's a high risk of exposure in terms of removal. We have been advised by the FPBS warehouse to actually look at the package of PPEs that arrives to IPC, every IPC personnel, to actually remove the coveralls and repurpose the coveralls for other usage. But in terms of cleaning, this is something that coveralls can be useful. But I still get a lot of requests from doctors serving in other areas that they prefer to wear the coveralls. But I would like to see here that coveralls is in the sequence of removal. In the sequence of removal, you got to know the process of removing. Otherwise, you can actually get exposed in the process of removal. We've actually I've identified most of our drivers, because we give them the coveralls to wear, but in the process of the removal, no one is there to actually supervise the removals, and most of them must have got exposed in the process as well. That is the basic reasons why that we need to advise our clinicians and ask them that that coveralls are basically not recommended for use.
Naka, thank you, Sister Ili. So the other question is from Dr. Rajiv, just asking about cleaning and sanitation, disinfection of common staff areas. So what if they don't have access to the disinfecting agents? What are some of the ones that we could use in hospital?
Thank you, Funwai. Thank you for that question. Yes, for our disinfectants agents that are currently available at the hospital, we have alcohol, 70%, and we also, that is prepared by pharmacy, and we also have sodium hypochlorite that comes in two separate concentration. One comes in 1% and one comes in 0.5%. So that is the disinfectant that is available. Like if for disinfecting of areas, surfaces at work, if you have alcohol 70%, you can use it. As long as you have a clean Wet-X, it can be ordered through stores, and if you have paper towels or for that matter, you can also use it. And but if we do not have you do not have alcohol, you can use sodium hypochlorite. Sodium hypochlorite in liquid detergent, and also warm water to actually neutralizes it. If you use it for disinfecting the surfaces and areas. If you use sodium hypochlorite, it needs to be neutralized with warm water, and then that can be, or you can use it together. You can use warm water and detergent, and then disinfect with sodium hypochlorite, and then with warm water. But first, it should be cleaned with a neutral detergent if you are using sodium hypochlorite. If you're using alcohol alone, or if you have alcohol wipes, then you do not need to use any other. You can just use excuse me, alcohol wipes, which has approximately 70% of concentration of alcohol, and that's good enough to clean up areas or surfaces, easily access surfaces in the clinical areas.
So sister, we've been getting some messages from certain wards, the COVID wards. Just they're a bit concerned that some of their PPE supplies are running low. Can you just advise us a little bit about the PPE distribution, please?
Thank you very much, Bunwai. To our colleagues that are actually in isolation, looking after our COVID cases, you know that it's very important that we know that the PPE shortage is not only locally, but it is also global. So we do not have the luxury of getting PPEs every now and again, and then because a lot of areas too are actually provided with PPEs. But for us in the isolation units in the red zone, it's very important that you work out the number of staff that has to actually walk into your red zone every day, and then you work out, bundle up your activities, work out the activities that needs to be done daily, and then you work out the PPEs that is required for that activity, and then you risk assess your activity.
Thank you, sister. So ladies and gentlemen, colleagues, do you have, is there anybody who wants to ask a question to Sister Ili? I know we're approaching 1 hour. Does anyone have any burning questions for IPC? Okay, set. So we'll take that as a no. Thank you. If you have any questions or queries, feel free to email us at IPC. You can get our emails. Just send me a message and I'll send it to you. Otherwise, thank you very much, Sister Ili, for taking time out today to run this training. And thanks everyone for tuning in. And we'll arrange further lectures on IPC if they're required in the future. Have a good weekend.
Naka.